America has more people incarcerated than anywhere else in the world, and there are big problems. Prisoners say their health care is being overlooked.
When you sentence someone to prison, the state owns the body. Basic human rights are gone.
Experts want urgent reform, and they say that human rights aren't being met. Here in New York, the square starts now. Welcome to Times Square. I'm Sally Ihan. On this show, we'll be talking about healthcare in prisons, and we want to hear your thoughts on the issue. You can contact us on Facebook or Twitter at TRT World and be part of the conversation. Now, there are over 2 million adults in the US who are incarcerated. Nearly half of them suffer from mental illness. Many have substance abuse problems and some have chronic health conditions. But healthcare in prisons here is not standardised. In fact, according to the American Civil Liberties Union, the US is the only democracy in the world that has no independent authority to monitor prison conditions. So let's hear more. Andre was released from prison 10 years ago. Since then, he's worked with other former inmates who are trying to reintegrate into society.
I knew that anything I got into that was negative was going to interfere with me getting out.
He was incarcerated in his early 20s for manslaughter and drug trafficking and served 16 years in a New York State prison.
So while inside, I witnessed people like getting stabbed or getting cut. I witnessed different forms of abuse by correctional officers. I witnessed people being placed in solitary confinement. And it wasn't all of the correctional officers necessarily, but there was a certain abnormality in that environment that wasn't conducive to developing human beings.
Andre says that being in a prison made him feel less human. He understands that he lost his freedom because he broke the law, but says things were worse for him because he's black.
The healthcare was inadequate at best. And while you may have received some medical attention, the attention wasn't the kind of deep attention that one would get if you had private health care or you paid for health care. So not having that kind of resource to fully deal with people's health needs, people develop high blood pressure, people develop diabetes because of the substandard nutritional factors inside of the food. And it's not to suggest white folk didn't have some understanding of poverty and those other factors, but they knew by virtue of their skin color that it gave them access to privileges that blacks and Latinos didn't have.
Mass incarceration began in the US in the 1970s. The growth in America's prisons was part of a policy that demanded stricter sentencing laws and a promise to be tougher on crime. Today, America has the highest incarceration in the world. Over 2 million adults are incarcerated. More than a third of that population is African American. That leaves nearly 3 million children with a parent behind bars. Healthcare standards vary from prison to prison depending on the state, and prisoners sometimes have to pay for their healthcare.
For an incarcerated person to pay a $5 copay, it may be almost their entire month's salary.
Marilyn Ralston was convicted of first-degree murder and spent 23 years in prison.
When I was incarcerated, I've had to make those hard choices myself. Do I put in that copay requesting a visit to the doctor because my head's been hurting or my back's been hurting for 2 days in a row, and then I have to wait a couple weeks for the visit? But they put a hold on my account for that $5, and if all I make is $8 a month, then that leaves me with $3 left to spend. And if I have more than $3, what can you do with $3?
Marilyn is now the program director for Project Rebound, an organisation that supports prisoners wishing to enrol and graduate from university. She wants the prison healthcare system to be reformed and says that people in prisons struggle disproportionately with health problems. Findings from the American Civil Liberties Union show that nearly 12 people die each day in a US prison, and nearly half of the jail population suffer from mental illness. 2/3 of inmates are addicted or dependent on medications, but only 11% receive treatment. Marilyn also says the specific health needs of women aren't often met.
Prenatal visits, prenatal vitamins. Yes, they're going to give you a bag of vitamins and then you're going to see a doctor. But is it really good care? You would have to ask the mother did they feel like they were taken care of? And for my friends who were pregnant inside, they never felt that they were. Basically, you go in, they take your blood pressure, your temperature, ask you a couple questions, and if you answer them the right way, then okay, we'll see you in 6 months. In California, we've had a problem with women being sterilized after they give birth. They didn't even know that they were being sterilized.
She puts it down to a nonchalant attitude to healthcare, which manifests over time.
For older women inside who are menopausal, who are going through, just the body changing and aging, because when you're inside, there's really poor nutrition, there's poor sleeping conditions, ventilation is terrible, people are not sleeping well, there's this overexposure to light, and so folks are, just not doing well over long periods of time.
There is an increasing aging prison population, and many with chronic diseases. Renee was one of them.
I woke up one morning and I couldn't see. Well, it was blurry, everything was blurry. And I said, damn, I'm getting old, maybe I need some glasses. I'm not realizing that something is coming out the corner of my eye really bad. And I took another guy to tell me, he said, man, something's wrong with your eyes, man. Go see the eye doctor, tell him it's an emergency. Yeah, okay, I think I will, because the vision was really bothering, I see this nurse, she was an RN. She stepped out the room, came back in with my medical chart and says, you have glaucoma. I said, what is that? She said, I done seen it 1,000 times. They told me you have severe glaucoma, more so in the right eye than the left eye. The prison should have told you this long time ago and treated you. I don't know why you wasn't treated, but we do know that the medical stinks in prison. We hear a lot of this stuff, and you guys end up coming to us after it's too late.
Prisoners are expensive to maintain. The average prisoner costs about $34,000 a year, but they also make money. When the state is unable or unwilling to build more prisons, private companies step in and profit to maintain and run the facilities. It began in the 1980s under the Reagan administration and is part of a growing trend. But the theory behind private prisons isn't emulated in practice and has been strongly criticised. Rights groups say prison industry lobbyists have actively promoted the campaigns of anti-immigration hardliners, where harsh policing and sentencing standards for drug-related violations, non-violent crimes and other offences by young and poor has fuelled mass incarceration. Following President Donald Trump's election victory, shares in private prisons skyrocketed. And under his zero-tolerance policy, Trump has proposed giving billions to private companies to detain illegal immigrants. But evidence shows that private companies are cutting corners on essential services to turn a profit. One of the nation's largest for-profit prison healthcare providers, Corizon, has become the target of thousands of lawsuits. The suits involve a crisis-level shortage of nurses, doctors, psychiatrists and other medical staff, and serious but treatable illnesses that went untreated and turned deadly.
I mean, I've read of many cases where there's somebody on the floor, they're having a heart attack, or they're having a seizure, or they're in terrible pain and they're screaming, and maybe other people on the tier are screaming to the officers to get them medical care, and the nurse or the officer just assumes that they're faking, and then the person dies. So, there's case after case like that. And I think the kind of skepticism, hostility, disdain, indifference, all of those emotions that you imagine are wrapped up in a response like that, you see filter through the prison medical system.
Suicide is the leading cause of death in correctional facilities. In 2014, 50 out of 100,000 inmates killed themselves. That's compared to 13 people out of every 100,000 on the outside.
I've seen officers use force against a mentally ill prisoner who just couldn't follow the rules. And that's just a snapshot that happens, again, in every single prison, in every system around the country every day, because mentally ill people have trouble responding to orders and controlling themselves in a way the prison wants them to be controlled. And in solitary confinement, it's terrible, because you take someone with mental illness, you put them in long-term solitary confinement, and They need treatment, but instead they're left to deteriorate. And that's how you end up with people cutting themselves. Or, as we just saw out of these photographs out of Alabama, writing in blood on the wall a cry for help.
But legal barriers have made reforming prison conditions nearly impossible. A person who commits a crime no longer has the same rights of those who don't. The question, though, is where do those human rights start and end for those who are incarcerated?
People will say, why should prisoners get free health care when people in the free world don't get free health care? And the answer there is, to my mind, there are a number of answers. One is because the Constitution requires it. Another answer is because we've forced people into conditions where they are locked away from society and have no capacity to provide for their own needs. So if they don't get health care, they're going to die a slow and painful death, which the Supreme Court has likened to torture.
Some experts say the solution is to limit the numbers of those incarcerated, but those who've lived it feel the problem is far deeper.
We're culpable for the decisions that we make, but we also know that the environment influences us in many different ways. So you remove all of those things, right? Then your relationships deteriorate because you may not have the kind of education you need to effectively communicate, right? If you don't have the monies necessarily to put food in your mouth or to pay for rent or housing in many ways, right? You resort to behaviors to survive.
When facilities are crowded, you can't provide adequate health care. So what you need is a commitment on the part of society to provide adequate health care for the people we have chosen to incarcerate, and also a recognition that we have simply incarcerated far too many people if one of the obligations we have to the people we put in prison is to provide adequate health care. We just have set up a system where it is literally impossible.
Although people have made poor decisions and have harmed people, that does not exclude them from being able to redeem themselves and to live a life of contribution in some way. And if we want this person to live a life of contribution upon their return, it makes sense to invest not only in health care, but mental health care, but also education, and also programs to support transforming this person so they come out an asset rather than a liability. To demonstrate the realm of possibility for all of us. To my son, the streets became a surrogate father to me. Let me define what we mean by that.
Now let's talk more about these issues. With me here are Esther Lim, she's the Director of Monitoring and Policy for the Correctional Association of New York, and Julian Adler, he's the Director of Policy and Research for the Center for Court Innovation. Welcome to you both.
Thank you.
Now Julian, why are there so many people incarcerated in the US?
There are so many people incarcerated in this country because of deliberate policy decisions to charge and incarcerate more people for more crimes and for longer periods of time than any other nation in the world.
What are the driving forces behind that?
The driving forces are multiple. One is enormous discretion at the local level by police and prosecutors to arrest, charge, and ultimately incarcerate people. Punitive policies on the state and federal level, such as tough on crime legislation, 3 strikes policies, mandatory minimums, as well as a punitive culture, a punitive approach to thinking about how to respond to complex problems born of even more complex circumstances.
And Esther, you've worked in both Los Angeles and New York. How does the role of different state law contribute to mass incarceration?
I think just the inconsistency, plays a huge part, right? One state, may look at criminal justice reform and apply criminal justice reform in the way they look at mass incarceration, whereas other states may be a little bit more conservative and more on the tough on crime, perspective. And America has an addiction problem. They are addicted to mass incarceration as a way to cure social ills, right, in a cover of public safety.
How do you break that cycle, Esther?
Part of the solution is looking at the way that we incarcerate, why we incarcerate, and also, I think we're also realizing, prison is something that we know doesn't work. There's studies, there's research that show that putting people behind bars doesn't rehabilitate, it doesn't make people safe. there's still a risk of recidivism, and yet we continue to use incarceration as the only solution on the table.
Picking up on that point, in fact, there is a difference between jails and prisons. Of course, jails have a higher turnover rate than prisons, where inmates usually have longer sentences. But while prisons have their own health concerns, the health issues are particularly acute in jails. Why is that?
When you look at the challenges of attempting to regulate or standardize healthcare in prisons, those challenges are magnified in the jail context for a number of reasons. First and foremost, there are over 3,000 local jail systems in the United States, and there's much more variation in the quality of care. There's also tremendous churn. Individuals coming in and out of jails. In any given year, we see up to 12 million jail admissions in the United States. So you have heavy volumes of people entering jails, leaving jails, and there's really an absence of oversight or regulation unless you reach a point where your jail is overcrowded and there's federal intervention. From a health perspective, the conditions are deplorable. From a constitutional or legal perspective, we have to remember that over 60% of the jail population in this country is still legally presumed innocent. And the only reason that they're languishing behind bars and jails, not receiving adequate health care or mental health care, is because they can't afford to pay money bail.
Picking up on the topic of mental health there, nearly half of the people held in incarcerated institutions in this country have some sort of mental health illness. Mm-hmm. How is it managed across the board?
The U.S. Supreme Court, through Estelle and Gamble, has already said that, when someone enters the, carceral institution, the onus is on the prison or the jail administrators to provide that adequate health. And what we're seeing nationwide is that that's not occurring. We're also talking about a population that comes into the system, in sometimes very poor health, because we, criminalize homelessness. These are folks that don't have access to medical or mental health care, and then they enter into the criminal justice system. And
you spend a lot of time in prisons. Can you give some examples of what you've seen?
So we're talking about people who, have not engaged in preventative healthcare. So they're already in a kind of a delicate health position. And then when they are getting delays, they're not able to see a doctor in a timely manner. So waiting weeks or months.
And I would just echo the point and say, from a mental health perspective, one thing that we know is that the majority of the incarcerated population has experienced some form of trauma. And the worst place to be if you've experienced trauma, if you're suffering from complex trauma or post-traumatic stress disorder, is a chaotic and violent and unpredictable environment. And that's exactly what you find behind bars and jails and prisons.
So what are the solutions here, Julian? Do you think that there are some solutions to the problem of mental health in prisons?
So the good news is that at every point along the criminal justice continuum, from initial contact with law enforcement, the decision to arrest or divert, all the way through sentencing and decisions made post-sentencing, there are safe and effective alternatives to pretrial detention and incarceration. The reality is there's solutions to these problems. It's less about the pragmatic challenges of avoiding incarceration and, to Esther's point, breaking our addiction and our default assumption that we should be incarcerating everyone who comes in contact with the justice system.
I want to bring up the issue of race. I think it's not an issue we can really avoid here. There's a long history of race relations in the prison system in the US. Can you give us a broader picture, Esther, of what you've experienced and seen in terms of race relations in the prison system?
I feel like we can't talk about mass incarceration, prison, jail without talking about race. It's modern day slavery. When you look at who's behind bars, you can't say that it is not it's not a racist system. The majority of the people that are behind bars are from Black and brown communities. And part of this is because we do criminalize, Black and brown. America is a very racist society that we've created these racist institutions, and we call that now public safety.
How do you fix a problem like that? Is it more than just an institutionalized problem?
It's certainly more than just an institutionalized problem, and it really requires a reckoning with this country's racist past and a willingness to re-examine how we approach the administration of justice. I would argue, and I think it's important to note, that it can't just be about humanizing confinement. It has to be a dual project in this country of humanizing confinement and dramatically reducing the use of incarceration.
I'll just move on for a moment. In your experience, Esther, how have women been treated, or pregnant women specifically, in prisons?
Well, first, I think we have to address that the population of women who are being incarcerated is steadily increasing. There is a different gender lens when we look at the way that we incarcerate women. Decision making that women have, that also needs to apply, when they're behind bars in terms of, access to abortion, access to pre and postnatal care, the way that they are cared for while they're pregnant, also after they give birth. When you take the primary caretaker away from the home, we have now created what we call generational incarceration. There's studies that show that when a child has a caretaker in prison or in jail, it increases the risk of that child then entering the criminal justice system.
We're also, Julian, looking at an ageing population in prisons. It's staggering figures. From 1993 to 2013, the number of inmates over the age of 55 increased by 400%. And of course, that would come along with some chronic health issues. How do systems of the state manage the cost of an ageing prison population?
I think the only way out of this problem is to reduce the length of sentences, to reduce the use of incarceration, and to rethink sentencing. To return to a theme that we discussed earlier, the specter of public safety risk. Research does show that there's such a thing as an age crime curve, and that most individuals who engage in behavior that's criminalized age out of that kind of behavior. In terms of what to do now when we have an aging population behind bars, the first step is to provide adequate care. Right? We can reach the next level of how do we provide more customized, holistic responses, but we're not even at the baseline of adequate care.
I want to pick up on the topic of privatisation now. What are some of the policies behind the driving force of privatisation of jails?
I just think that when your business model is about incarcerating people, that's a horrible business model to start off with. Incarceration just doesn't work.
And what are they doing to make a profit is what I'm interested in.
Well, what I was going to say, and I'm glad you asked about profit, is essentially by privatizing prisons and jails, we're adding another incentive to incarcerate. We're adding a profit motive, and based on what's been reported and studied, the way that profit is made is by cutting cost and offering the lowest standard of care imaginable, which happens to also be unconscionable.
One of the biggest healthcare providers, Horizon, has had over 1,000 legal cases in the past 5 years for issues that include alleged neglect, malpractice, wrongful injury or death. Now, if companies are in such legal hot water over this, why wouldn't they want to just fulfill their contracts and do what they were hired to do?
I mean, the good thing with is that a lot of jails and prison administrators who have contracted with Horizon because of these lawsuits, because we're seeing massive medical neglect, are they're canceling contracts. And hopefully that's a signal that there needs to be more oversight over the way that healthcare is doled out inside prisons, but also a re-examination of how we are privatizing justice.
You see that money corrupts and corrodes throughout the criminal justice system, and that really what we need to do is get money out of the system and focus on that normative idea of justice, which is supposed to be what justice is about in America.
We're talking about the intricacies of the human rights of prisoners here, but what about the perspective of the victim?
This general notion that victims of crime would be opposed to alternatives to incarceration or the humane treatment of defendants standing before trial or inmates incarcerated in a facility is mythological, and I think it walks with the myth of public safety. I think these are ideas that we have, that we use to rationalize bad policy, and until we confront that rationalization for what it is, we're never going to be able to get out of that.
And Esther, where do we draw the line here? I mean, human rights seems like a fairly ambiguous thing when it comes to the prison system. They don't have freedom as it is, the freedom or right to move around. So, what is the human right of prisoners in this case?
I mean, I think the fact that it has to be posed a question, we have to talk about, right, like human rights for prisoners, and I think that is kind of the foundation kind of question that we as a society needs to really think about. right? That there shouldn't be a difference between, a free person and someone who's incarcerated. My rights are their rights, and yet we have kind of distinguished that, and therefore have allowed for, mistreatment of people who are incarcerated, for allowing, subpar medical and mental health treatment to be allowed because it's, that's what you deserve.
What's interesting, though, is that Americans incarcerated are the only people in the country that have the constitutional right to health care. There'd be many people out there that would say, well, hang on, I didn't do anything wrong. I didn't break the law. Why did I get health care? Why should criminals get health care?
And again, I don't accept the premise of the question, and I don't accept the premise of the question when it's posed by anybody. The premise of the question is that individuals who are incarcerated are somehow less than human. And I think this really is at the heart of all of these policies, both historical and current, and until we can shift the paradigm, until we can treat individuals who are involved in the criminal justice system or incarcerated as fully human, we are not going to get out of the mess of mass incarceration.
I think we'll leave it there. Thank you very much to you both.
Thank you.
Really interesting discussion. And lots to talk about, but we'll have to leave it there for the time being. So thank you to both of our guests. And if you have any comments on the issues discussed in today's show, you can contact us on Facebook and Twitter @TRT World. And thanks to our team here in New York. Please join us next time on The Square.